Ladies and gentlemen, welcome to the annual Galien Awards ceremony.
The Galien Foundation fosters, recognizes, and rewards excellence in scientific innovation to improve the human condition.
André Malraux said once in one of his novels, "Une vie humaine ne vaut rien, mais rien ne vaut une vie humaine." Human life is worth nothing, but nothing is worth a human life. All these men and women are trying to save human lives. Is there anything more noble than that?
The Galien Awards ceremony is considered the equivalent of the Oscars night for the innovators in the labs and awards every year Best Pharmaceutical Product, Best Biotechnology Product, Best Product for Orphan Rare Diseases, Best Medical Technology, Best Digital Health Solution, Best Incubator Accelerator Equity, Best Startup. Around the globe, the Prix Galien is considered as the equivalent of the Nobel Prize for the industry, mobilizing an unrivaled network of Nobel laureates and top biomedical scientists. The Galien Foundation manages an independent, cross-functional, and geographically diverse program of events and sponsorship to brand the best of the best in new medicines and diagnostics. The Prix Galien is a welcome initiative to stimulate creative research and promote excellence. Barack Obama. The Roy Vagelos Pro Bono Humanum Award for Global Health Equity is bestowed to an individual, a company, an academic institution, or a non-governmental agency that has helped to improve the human condition through the application of biopharmaceutical science to problems of developing or underserved populations worldwide.
This is the right event, on the right issue, at the right time.
Staging this event in Africa is a significant statement that science and innovation are needed as much here in Africa as anywhere else.
I'm particularly grateful to receive this award.
The awards are among the highest honors in science and commerce because they lead to improvement in the human condition.
The Prix Galien Awards recognize the world's brightest minds and most innovative companies. They are a true celebration of the hard work required to produce life-changing interventions.
That is what makes us optimistic about the future.
Congratulations to all of you.
Make a difference. Join the Galien Foundation.
As scientists, we live on the very edge between what is known and what is yet to be known, standing on the shoulders of giants to peer over the horizon, healing doubts as well as diseases. In the last 50 years alone, we've seen miracle babies who now have babies of their own, who may grow up never hearing the words smallpox, polio, measles, and live decades longer than their grandparents. Why? Because science. We witnessed a whole new body of medical advances that came from inside the human body itself. Because science. Heartbreaking quilts stopped being made. Artificial hearts started beating. SARS was contained and controlled. And even diseases like COVID-19 will yield. whatever challenges humanity faces in the years ahead. The last 50 years shows us that we can prevail. Why? Because science.
Ladies and gentlemen, it is our distinct pleasure to introduce Professor Michael Rosenblatt, who serves as the chair of the Prix Galien USA Committee for the categories Pharmaceutical Product, Biotechnology Product, and Product for Orphan and Rare Diseases.
Welcome and good evening. Many of you have spent the day with us at the Galien Forum 2023. It was really a spectacularly successful day, and it came after a full week of the Week of Galien Innovation, in which there were about 15 webinars describing what each of our nominees are and have accomplished. And you will be able to read more about each of them in a book, a golden book, that'll be at your table tonight. But this evening is for the best of the best. So we're celebrating science and medicine and innovation, and of course, our major awards will be given this evening. But in order to kick off the evening so that you have a sense of the nominees, and the awards will be later tonight at the dinner, we're going to play a video for you which will tell you each of the nominees in the first 3 categories of this evening. So please roll the video.
The category Best Pharmaceutical Product, the nominees are Alchemies for Lybalvi, Amylyx Pharmaceuticals for Relivrio, Aurinia Pharmaceuticals for Lupkynis, Blueprint Medicines for Ayvakit, Blueprint Medicines for Gavreto, Decipherer Pharmaceuticals for Quinlog, Eli Lilly and Company for Manjaro, Epizyme for Tazverik, Genentech, a member of the Roche Group, for Ocrevus, Genentech, a member of the Roche Group, for Vabysmo, Gilead Sciences for Sunlenca, Insight for Pemazyre, Insight for Opzelura, Ironshore for Jornay PM, Janssen Pharmaceutical Companies of Johnson & Johnson for Rybrevant, Main Pharma for Next Stellis, Mirum Pharmaceuticals for Livmarli, Novo Nordisk for Ozempic, Sumitomo Pharma America for Myfembry, Sumitomo Pharma America for Orgovyx, Pfizer for Bravtovi plus Mektovi, Pfizer for Sabinco, Sanofi for Tzield, Servier Pharmaceuticals for Tibsovo.
In the category for Best Biotechnology Product, the nominees are Albireo Pharma for Bylvay, Amgen and AstraZeneca for Tezspire, Argenex for Vyvgart, Vigene for Brukinsa. Bristol Myers Squibb for Camzyos. Daiichi Sankyo and AstraZeneca for Inertu. Imogen for Elahere. Jazz Pharmaceuticals for Rylaze. The Janssen Pharmaceutical Companies of Johnson & Johnson for Tecvayli. The Janssen Pharmaceutical Companies of Johnson & Johnson and Legend Biotech USA for Carvykti. Merck & Co. for Vaxneuvance. Pfizer for Prevnar 20. Regeneron Pharmaceuticals for Evkeeza. Regeneron Pharmaceuticals and Sanofi for Dupixent. Seagen for Adcetris. VBI Vaccines for Prix. Ex Vivo Perfusion for XPS with Steam Solution.
In the category Best Product for Rare and Orphan Diseases, the nominees are Boehringer Ingelheim for Spevigo, CSL Unicure for Hemgenix, Horizon Therapeutics for Tepezza, Immunocore for Kimtrak, Sanofi for Zempezime.
In the category for Best Medical Technology, the nominees are Alcon for Acrisoft IQ Vivivity Extended Vision Intraocular Lens, Bausch & Lomb for Zypir, Body Vision Medical for Lung Vision, Boston Scientific for Illuvia Drug-Eluting Vascular Stent System, Boston Scientific for Spacer View Hydrogel, Boston Scientific Baylis Medical for Versa Cross Transeptal Platform, CVRX for Barostim, Edwards Life Sciences for Edwards Sapien 3 Transcatheter Pulmonary Valve System with Altera Adaptive Pre-Stent, Edwards Life Sciences for Edwards Sapien 3 Ultra Resilia Transcatheter Aortic Heart Valve, Endologics for Detour System, Flowsonics Medical for Flow Patch, GT Medical Technologies for Gamatile, Guardant Health for Guardant 360 CDX, Impel Pharmaceutical for Trudesa, Impulse Dynamics for Optimizer Smart Mini System, Lantheus for Pylarify Injection and Pylarify AI, LifeVac for LifeVac, Olympus America for BF UC190F Endobronchial Ultrasound Bronchoscope, Organon for the JADA system, Outset Medical for Tableau Hemodialysis System, Polarian for Xenoview, QT Medical for PCA 500, Roche for Alexis Beta Amyloid 142 CSF2 A Beta 42 and Alexis Phospho Tau 181P CSF P Tau 181 assays, Solodex for Solodex Facile, Standard Bariatrics for Titan SGS, Terumo Aortic for Thoraflex Hybrid, Unicancer for Papillon System, Valencia Technologies Corporation for eCoin Tibial Neurostimulator,